Nigerian social media space has been buzzing and a lot of reaction following the demise of a Nigerian socialite, Elena Jessica, after complications from a second BBL procedure at Sinosure Aesthetic Plastic Surgery Hospital in Lagos. This is an uneasy tale of a 20-year-old Nigerian socialite who has been reportedly passed after a botched second BBL procedure. According to the story, the former doctor refused to do the second BBL for her because her skin was very tight and there was no space to add extra fat, but she went ahead to do it in another hospital. This story is a very pathetic story. Elena Jessica is the breadwinner of her family. The father is retired. She has gone for first BBL. And when you look at this lady, she has that banging body. She has that figure 8, the hour shaped. She got it. So I don't know what pushed her for this second BBL surgery that she has gone for, that she went for liposuction, and the fat was transferred from her hip, butt, calves after she started experiencing severe pains in the operated areas. 2 days after, medical tests revealed that she has been infected with very high white blood cells count and her blood level very low, which made the doctor to administer blood transfusion of 5 pints of blood. Pay attention, 5 pints, 500 ml for 1 pint. That means 2,500 was transferred to her. Her condition kept getting worse. Infection increased. Her butt, hip, calves became very swollen. The doctor assumed too much fat had been injected, which made her to undergo another surgery on the 13th of February to remove most of the fat. She was in a terrible pain. On February 19, she was transferred to Lagos State University Teaching Hospital. And when they got there was no bed in ICU. ICU is supposed to be intensive care unit where you bring people that have very serious cases to the hospital. That's where they stay. So from what they're saying is that she spent 5 hours in the ambulance because there was no free bed in the ICU. Probably all the beds were occupied. And then she was screaming in severe pain. The nurse that accompanied them did not bring pain relief injection, and she was left stranded. The nurse made some calls and said that the MD asked her to take her to another hospital in Festac. When they got there, she left them. They paid 1.5 million for 1 day in ICU. No plastic surgeon attended to the case. The family to move her again on the 20th of February to another doctor who informed them that there was plastic surgeon in the hospital. So when they arrived at this new hospital, the medical team presented them with a bill of 6 million to cover 1 week of intensive care and the cost of surgery to remove the infected fat. They have sold almost all their belongings to raise the money so that they could start the treatment. So according to the doctor, she has sepsis. She had 50-50 chance and more tests showed low blood level. They also bought 7 pints of blood. On February 22, she had another surgery where doctors removed all infected fat from her hips, but she needed another surgery in a few weeks to close the large open wound from the body. So when you look at this thing, I keep wondering, you've gone to correct one thing, then you're subjected to other surgeries to get that thing corrected, being in pain. When you check the pints of blood that has been transfused, it's like 7 plus 5 now, 12 pints, 12 times 500, because 500 milliliter is a pint. That's 6 liters of blood. That's a lot. The whole blood has been recycled. The friend called out the hospital, calling justice for her friend Jessica.
Senosho has to end. Enough is enough. This is your last Senosho, I promise you. What happened to Elena? Mind you, Elena did not go under the knife again after 6 months or 1 year post-op. We need justice. Senosho's license has to be revoked because Elena's won't make out. We're talking about a man that butchers our girl on a daily basis.
The hospital has long released a statement as regards this. So the question is, why is it that people want to do BBL? This has become a pandemic, not only in Nigeria, but all over the world where you have colored people. Most women want to change one thing or the other in their body. So according to this article, BBL procedure has the highest risk amongst all the cosmetic surgery. The procedure in black women has higher risk as compared to their white counterparts because of underlying health conditions such as hypertension, diabetes, anemia, which can increase the surgical complications that include blood clots, poor healing, and longer hospital days.
It's the most fatal operation in all of plastic surgery. Or a BBL is where you take fat from one part of the body through liposuction and inject it into the buttock area. The chances that that fat will get into one of those short blood vessels leading to the main blood vessel going back to your heart is elevated. That can lead to a very fatal or dangerous complication.
Then when you look at this stress, does it really worth it? That's my question. I know some people, when you ask people why they do it, they say they're not doing it because of man, they're doing it for their mental health, they want to look good, there's one thing they want to change. Babe, before you go under a knife, before you go for any plastic surgery, make sure you do your research very well. There are lots of risks involved in this, and some of these doctors are not even qualified surgeons that will be able to conduct this operation. Most of these people, they're so quick to jump to any hospital to get themselves opened up, pumping some fat, and people don't even understand the procedure very well. If you understand the risk that's involved in this surgery, then you will not be so quick to do it. A lot of people have reasons why they go under the knife. Some people because they've had babies, they want to correct their body to look normal. But a 20-year-old going for BBL, I don't know how to explain that. I don't even know. This is a very sad story. It's quite unfortunate. Each to their own. You can do whatever you like with your body, but you have to check the risks that are involved before you jump on it. This lady, the way she's looking pink. I don't know what pushed her. At the end of the day, the body is well sculpted if you go to a good surgeon that does a good job. The question that nobody asks is, as you age, when you get older, how does it look? Does it still stand firm or it starts sagging? One of the influencers who did BBL, she said that ever since she has done it, she had a lot of traffic. She is being attracted to so many men, so probably they do it for attraction, to stand out among the crowd, to have more attraction from men. And when you have more attention, what comes with it? Is it not money? It's money that comes with it. I don't understand a 20-year-old going under a knife to have a banging body. There was a video that VDM also circulated about 3 months ago of a lady on the 8th of November that went to Glorified Hospital in Kubwa. The father is a Nigerian, her mom is an Ivorian. She came from Abidjan, Ivory Coast, all the way down to Abuja to do tummy tuck. According to her, that she has a baby. The price for the tummy tuck is 7 million, but because they were on promo, they charged her 3.5. Then after the surgery, she saw lots of blisters with water all over. Then she had to go back to Lagos, where she had her family. When the situation continued, she had to call them. She came back to Abuja. Eventually, they abandoned her, said that the doctor that operated on her was Dr. Sandra of Glorified Hospital in Kubwa, allegedly. And she had to make a case. It went viral. You have to do a lot of research. They don't even understand what the health system in Nigeria is all about right now. There are lots of doctors who are leaving the country. What it means is that you have less doctors that will care for patients in Nigeria. So if you want to do yourself a favor, make sure that before you go to hospital for any procedure, make sure that the doctor knows what he or she is doing, that the hospital is well certified for whatever procedure that they're doing. Check the risks that are involved, if it's something you'll be able to manage. Also check their success rate. People that have done that procedure in that hospital, what is the success rate? The thing is that all these private hospitals, you have complications, you end up at the tertiary hospital, like a teaching hospital, like Lutz in Lagos. Most doctors are leaving public service, are leaving Nigerian health system for better life abroad. So you might get there, you have a lot of patients to one doctor. By the time they get to you, it might be a forgotten story already. So people need to be more careful of what they do with their life, what they do with their body in Nigeria. The health system is becoming bad. No good infrastructure. In the first place, the government is supposed to do their due diligence to make sure that these doctors, these surgeons handling these cases are professionals, they know what they're doing. But I don't know if they actually pass the scrutiny of the Nigerian Medical Association. Let me know what you think in the comment section. This is actually a sad story. If you learn one or two things from this video, make sure you share with your friends. Let me know what you think about the pandemic of BBL blowing up in Nigeria. Young girls want an hourglass shape. Let me have your thoughts in the comment section below, and I'll see you in my next video. Bye.